That's next. Researchers confirmed this week what's been very obvious for more than a year. People who've been infected and then recovered from the coronavirus will likely, almost certainly, develop antibodies, and those antibodies will likely last the rest of their lives. In other words, they're immune. Therefore, they do not need the vaccine. Earlier this year, we spoke to one physician, Dr. Houman Norchazem, who realized this a long time ago.
The most unprecedented thing that we're doing in this vaccine campaign is that we're deploying it indiscriminately into folks who have been recently or previously infected. And I think that we shouldn't underestimate what the effect of a vaccine-driven immune response is on the tissues in individuals who have been previously infected. Literally, the antigenic footprint of the virus persists in the tissues of the previously infected. So it's not a far stretch to imagine that those tissues, such as the inner lining of the blood vessel, would be targeted by the vaccine immune response. And I have not yet seen any evidence, frankly, of the FDA or CDC taking this seriously. I think it's a major mistake to assume that you can put this vaccine into people who've been recently or currently infected and expect that no complications.
So people who don't need the vaccine are being compelled to get the vaccine. That's not an argument against vaccines. It's an argument against the misuse of medicine, any medicine, including vaccines. Rand Paul is a physician. He's also a U.S. Senator from the state of Kentucky. He's been infected with COVID. Obviously, he recovered. He's just written an op-ed on why so many are denying the science of natural immunity to COVID. We're happy to have him join us tonight. Senator, thanks so much for coming on. So will you just clarify, as a physician, in a sentence or two, how people who have recovered from COVID, the many tens of millions who have, should feel about their chances of getting reinfected?
Well, people need to understand that vaccines, the science of vaccines, is based on the science of natural infection. What they're trying to do with the vaccine is to simulate and get the same response that you get, or better, with a natural infection. Some diseases, like measles, when you get them, you actually have lifelong immunity. If you get vaccinated, after a couple of decades, you need a booster. So actually, natural infection is actually better than the vaccine in some ways for measles. Now, this isn't an argument against being vaccinated. It just happens to be if you got the measles, you've got lifelong immunity. Smallpox was the same way, but it's not an argument for getting smallpox. With COVID, we don't know yet. What they say all the time is you don't know how long you'll be immune. Well, I can look right back at you and say, I don't know how long the vaccine will work. They're already talking about a booster. When Dr. Fauci comes before the committee and we ask him, how many of those who are vaccinated already have the disease? He has no earthly idea. They're not even counting them. Even a good scientist would say we should look and see whether those who've already been vaccinated are somehow responding differently. I did see one study that showed that if you've already had the disease and you get a vaccine, you get 1,000 times greater response. Now, maybe that means 1,000 times better, or maybe that means you're more likely to get symptoms and side effects. So I don't think it's been studied thoroughly. I do know that in Israel there was a study recently, and it showed that those who were vaccinated and those who were infected naturally had about the same possibility of being reinfected, pretty small.
I'm a little confused by this. I mean, if your job is to promote and then disseminate the vaccine and compel people to take it, which is what we are doing, college students can't go back to school without it. So you're forcing this on people. Isn't it your moral obligation to find out what the potential harms are, what population should get it, which shouldn't? Why are they treating everyone the same and refusing to ask obvious questions?
Well, there's a huge public policy or public health question. In India, they don't have enough vaccines. So if Dr. Fauci is advising the world, which he seems to want to do, what should he tell them there? Should they give the vaccine to people who already had it, or should they save the vaccine for those who haven't had it? So this is a profoundly important question for a country that has 1 billion people and might have 200 million vaccines. Should they waste the vaccine on people who've already gotten it? The science says no, but Dr. Fauci says, no, we're all lemmings, submit. It's more about uniformity of submission and less about science.
These people are scary. And I appreciate your asking obvious questions. And thank heaven you're a physician. You still have a right to do that, I suppose. Senator Rand Paul. And for now. Thanks. Good to see you. Thank you.
Thank you.
What's so interesting is that a lot of people in public health seem in private to agree with what Senator Paul just said. Earlier this month, the heads of the FDA and the CDC, as well as Tony Fauci, admitted that about half of their employees have decided not to get vaccinated.
What percentage of the employees in your institute, your center, or your agency of your employees has been vaccinated?
You know, I'm not 100% sure, Senator, but I think it's probably a little bit more than half, probably around 60%.
Dr. Marks?
I can't tell you the exact number, but it's probably in the same range. Some people vaccinated at our facility and others at outside of the facility.
Dr. Winsky?
We're encouraging our employees to get vaccinated. We've been doing town halls and education seminars. Our staff have the option to report their vaccination status, but as you understand, the federal government is not requiring it, so we do not know.
Really one of the most remarkable tapes of the past year. So as people who work full-time in public health at the CDC, at the NIH, approximately half of them have refused to take the vaccine at that exact moment. And by the way, why? That'd be a good follow-up question. No one asked it. Why? But at that same moment, we're forcing kids to get vaccinated. College kids, many can't return. They're telling you to give the vaccine to your small children, too.
With the vaccine 100% effective for children in the clinical trial, the vaccinations are the best shot, say experts, for a safe return to school, to summer camp, and for sleepovers.
Trials are still underway for children as young as 6 months old, but by the end of this year, Dr. Fauci believes there will be a vaccine available for nearly all children.
A vaccine in the works for children as young as 6 months old. What should we think of this? Dr. Harvey Risch is with the Yale School of Public Health. Dr. Risch joins us now. Doctor, thanks so much for coming on. What do you think of that?
Pleasure.
Children getting the vaccine.
Well, the first problem that we have is we've dumbed down the discussion of everything. So we're at the level now of vaccine good, COVID bad. And, you know, other facts relating to that are just kind of inopportune. The problem is that children get the illness perfectly well, almost entirely. And for children who have obesity, diabetes, chronic illnesses that put them at high risk of bad outcomes from COVID, they are the ones who might consider being vaccinated. But for almost everybody, all children otherwise, it doesn't make sense because their risks are negligible. Now, the CDC has addressed this with its data. So it's seen that in approximately 470,000 Americans who've died from COVID, that includes approximately 400 children who've died either with or from COVID. That's not zero, but it's a very small number and comparable to children who've died from influenza in past flu seasons. So there's no real reason why children need to be vaccinated because they get immune from just their own interactions and they don't transmit the illness to adults and they hardly even transmit it to other children. Mostly children get it from adults, from their parents and so on.
So the whole reason we have science is to make the fine distinctions, such as the ones that you just explained. Why aren't the heads of our public health institutions saying exactly what you just said?
It's difficult for me to speak about why they think what they think. I think we're in a vaccine mania or a vaccine fanaticism stage. And, I think that if the goals are to show proclaim your goodness by vaccinating everybody, then you're looking to jab everybody. If your goals are to solve a public health issue as best you can, then it's a trade-off and you balance the risks and benefits as best you can.
I don't know how you've kept your head in the middle of this mania, as you just described, but I'm so grateful that you have. Dr. Risch joining us tonight. Thanks so much.
Pleasure.